Hi Delilah. So after going over your symptoms and reviewing your labs, we have diagnosed you with a pituitary adenoma resulting in acromegaly. So these are a lot of big words, but it's really not much to worry about. Essentially, a pituitary adenoma is a benign tumor on your pituitary gland, which is at the base of your brain behind the bridge of your nose, which would explain why you've been having those headaches. And the vision impairment can be caused by the tumor pressing on either the optic nerve or the optic chiasm. Now, pituitary adenomas are extremely common. They occur in about 1 in 5 adults. However, in most of these cases, they never grow and these people never see symptoms. However, in your case, the pituitary adenoma grew, and it's now known as a macroadenoma, which means that it's more than 1 centimeter in diameter. And so this really isn't terribly uncommon. Again, really the most important complication is pituitary apoplexy, which is the bursting of the tumor, and even that can be remedied with surgery, but since we caught it in time, you shouldn't have any worry of that. So the other thing that I want to talk to you about is the acromegaly, which is a result of your pituitary adenoma. And essentially, your adenoma is what's known as a functional tumor, meaning that it causes the pituitary gland to overproduce something, in your case, growth hormone. So the secretion of growth hormone from the pituitary gland stimulates the liver to produce insulin-like growth factor, which triggers bone and muscle growth, which results in your enlarged features, swollen tongue, the deepening voice from the enlarged vocal cords. Just about all of that can be explained. So generally, you also end up with enlarged organs because they are compensating for the growth of your body. Common side effect is hypertension, because your heart is working so hard to pump blood to all of your body. Now, we treated this, we diagnosed this by getting a CT scan that showed us the enlargement of your organs, and our next step would be to get an MRI of your brain to locate the exact position of your adenoma. And so our treatment goal is to lower the growth hormone levels, and what we're going to do is we'll perform a transsphenoidal surgery, which is essentially a fancy word. We're going to use an endonasal approach and remove the tumor from your pituitary gland, and then use radiation to target any remaining tumor cells. And we can also help to regulate it with medications such as growth hormone antagonists.